Hey guys, it's Dr. Shelley, and I am coming to you. Oh, hey, I am. Oh, hi, so it is time to do an in-office surgery. So, of course, that can be a little concerning for everybody, but it is a procedure. It's very simple when we do it in the office because it's a simple procedure. So, I don't want you to be worried. But there are things that we have to discuss whenever we're talking about doing a procedure, whether it's in the office or in the hospital or in an outpatient setting. So, with all surgery, there's a risk of infection. If you're not a diabetic, or struggling with sugar issues, then we don't give you an antibiotic. If you are a diabetic, then please make sure that I have prescribed something for you to take the day of surgery and the day after surgery. With any surgery, there's a risk of bleeding. And if we're doing you for a hysteroscopy D&C, then of course that's probably why we're doing the procedure. So we expect to have some bleeding. So if you're having a D&C, then expect some bleeding and cramping after the procedure. Um, hey, it's Dr. Shelley, and you are scheduled for hysteroscopy D&C in office. So this is a very simple procedure that we do very frequently in the office, and we utilize for most of our clients laughing gas. And so if you don't have a problem with laughing gas and you don't suffer from a lot of anxiety, the joy of being on laughing gas is that you can drive yourself to and from. You don't need to have a driver. If you do suffer from a lot of anxiety, then laughing gas is not an anxiolytic. So I do recommend that you let me know, and we will give you some Xanax and uh, pain medicine to utilize during the surgery instead. Um, but then you will require a driver. Plan to be at the surgery at my office for about 2 hours. You're not the procedure itself takes about 20 minutes. We get through there early. We get you situated. We get your medications on board, et cetera, et cetera. Get the room set up, and then we do the procedure for 20 minutes. And then if you're looking great, then we send you home right away. If you're looking high or like you need to lay down for a little while, then we let you lay down. You so please make sure your ride knows that it is a 2 hour stint if you do have somebody bring you. Like I said, if you're doing the laughing gas, it's in and out of your system very quickly. If you've never had laughing gas, it's lots of fun for most people. And a lot of our clients wish they could take it home with them. But it's out of your system so quickly that you can very easily get up and go home and drive without a problem at all. You know that I am always looking out for your best health. So if I tell you that you can come to and from without a driver, then you can come to and from without a driver. The risk of any surgery, including a hysteroscopy D&C infection, if you're not a diabetic, then we do not give you antibiotics. If you are struggling with sugar issues, whether you've been formally diagnosed with diabetes or not, please let me know and I will prescribe an antibiotic for you to take the day of surgery and the day after. Otherwise, like I said, no antibiotics. With any surgery, there's a risk of bleeding. Obviously, we're doing the D&C usually because of bleeding, and we are shaking things up inside of your uterus. So do expect a bloody, watery discharge, even a frank bleeding, even maybe some small blood clots for up to 3 weeks after the surgery. As long as you are not filling your shoe with blood, we are good. Um, with any surgery, there's a risk of damage to adjacent organs. We're going in with sharp instruments, so there's a risk of putting a hole in the uterus. That sounds very, very scary. It's called a uterine perforation. What's great about the uterus is very resilient. It is a muscle. So believe it or not, if we actually did put a hole in the muscle, we can actually stop the procedure and go back and do the same surgery 4 to 6 weeks later without any problem. The key thing is to know that it's happened. And I do enough of these. I know what it's supposed to look like inside your uterus. And as I always tell my clients, when in doubt, I get out. So if I'm concerned about where I'm located, I'm going to stop the procedure and come back another day. And usually what it is that it's not what we call a through and through perforation where we go actually through the uterus and we're on the other side. But normally, especially if you're prone to fibroids or anything like that, that we tunnel into the actual muscle of the uterus. But I know, like I said, what I'm supposed to be seeing and what all the normal planes are. And I know what to do if I'm not comfortable. So the other risk of course, we're not trying to hurt your vagina, your bladder, your bowel, your ureters, which run actually very close to the cervix, which is the opening to the uterus. And with any surgery, there's a risk of blood clots. That's called a deep venous thrombosis. They usually occur in your legs. If you had a blood clot in your leg and it broke off and went to your lungs, then that's a bad thing. That's called a pulmonary embolism, and we don't want those. Obviously, also, we're using fluid to open your uterus so we can see inside. Otherwise, it would be like a collapsed balloon. We wouldn't be able to see anything. If the fluid that we used to open up so we could see inside your uterus ended up in your bloodstream, that would also be not a good thing. So the key thing is to keep all the things where they belong. But if you had a pulmonary embolism, that can cause obviously shortness of breath, chest pain, and could lead to death. So we don't want that. With any surgery, we have to tell you that there's a risk of death. I tell people that, it's a very simple procedure. Like I said, we perform it almost daily in the office, and we do not expect anything bad to happen to you. And you take your life into your hands every time you get behind the wheel of a car, and we do it several times a day, and God willing, we come out on the other end. So I don't expect anything bad to happen to you, but with any surgery, we have to go through all of the risks. So I know it sounds kind of scary, but please trust me and when I tell you that it's a very simple procedure. Plan to be in the office for 2 hours. The procedure itself is only 20 minutes, but like I said, we get you settled beforehand. The procedure is done for 20 minutes, and then if you need to lay down and relax for afterwards, then plan to be there, like I said, about 2 hours. As far as taking medications, if your surgery is in the morning, then we're going to have you take a medication called Cytotec the night before to help to open up your cervix. The easier it is for me to get in. If your cervix is opened up naturally, the less discomfort to you. If your surgery is in the afternoon, then we have you wake up, eat a normal breakfast, and take the Cytotec in the morning, the day of surgery. If you are already bleeding even a little bit, you do not take the Cytotec at all, because if you're bleeding, that means your cervix is open, and that's all I'm trying to do with that particular medication. I do not want you to take any pain medicines on the day of surgery. We will give you all the pain medications you need when you get there. I do want you to eat a normal breakfast. You do not have to, if you normally don't eat breakfast, I'd like you to eat something light, but otherwise, just eat what you normally do. As far as your normal medications, as long as they do not make you sick, by all means take them. Especially if you're on blood pressure medicine, I definitely want you to take your blood pressure medication. If it's something else that you're not going to self-destruct if you miss, like say a thyroid medication or something in one day, or cholesterol medicine, and one day is not going to make a big difference, and it's something that makes you feel sick, then please don't take it, because I want you to be feeling good when you come into the office. Also, you're going home within 2 hours, so any medicine that you don't take before you come into the office, you can certainly take afterwards. But back to the blood pressure medications, please take those, because if you come in and your blood pressure is too high, guess what happens? We have to cancel your surgery. So please take your medications as you're supposed to, coming up into the surgery date and then afterwards. And like I said, only if you're a diabetic or struggling with high sugars will I give you an antibiotic. As far as pain relief afterwards, usually whatever you have at home. And if you've been seeing me, I usually am very, I don't like pain. And so you probably have a prescription already for either ibuprofen, 800 milligrams, or naproxen, or Celebrex. So if you don't have anything, then yes, I will give you a prescription for pain medication, because I'm not into pain. But you're not going to be needing a narcotic or anything like that. Basically, we give you pain medicine when you're here in the office, and then we send you home, and we tell you, usually it's about 5 to 6 hours after the pain medications you got here in the office, that you'll take one of those pain pills, and that's all you're going to need. Like I said, you can ignore everything coming out of the vagina for the next 3 weeks after your surgery. I don't care. You don't need to put it in baggie. You don't need to send me pictures. As long as you're not filling your shoe with blood, you are good. If you're already due for a period, you can trigger a period, and it may come a little bit earlier. That's okay. You can even pass some little small clots if there's a lot of gunk and bleeding and stuff up in there when we do the surgery. So pretty much ignore all bleeding for the next 3 weeks after the surgery, unless you're filling your shoe, and we will be good. We will be going over everything with you when I follow back up with you to review all your results from the surgery. So no worries. But if you did need me between now and the actual surgery, if you have a question, and there's no such thing as a dumb question, please contact the surgery scheduler so that you can discuss it. And she knows the answers to most of the questions, but if not, she will track me down and make sure that we get you your answer before surgery. And then after surgery, of course, if you're still concerned for any reason, if you're having fever more than 101 degrees on 2 separate occasions, severe bleeding, severe pain, severe nausea and vomiting, then obviously please give the office a call. We do have an after hours number, and you can track me down. So I hope that helps explain your surgery. I hope it alleviates any concerns you have. I know when you read the medical documents and for the consents, it sounds really, really scary, but these are medical legal documents designed to scare the bejesus out of you. As I said, hysteroscopy is where we look inside to see what's going on. You're going to get to see too. And even if you think you don't want to watch, curiosity kills the cat. And it's pretty neat to see like what I'm doing and what the inside of your uterus looks like. And then the dilation and curettage, we call it a dusting and a cleaning. So we look inside first and then we get our tissue samples and we are doing the procedure to say there's no infection, there's no bleeding, and there's no bleeding. There's no infection and there's no precancer and there's no cancer. So the results are not immediate. You will see what I see when we're going in for the surgery, but then as far as what we call the pathology results, we send the specimens off to the pathologist, who is the doctor that looks over those results. And then by the time you come back for your post-op appointment, we will have the results back to say that there's no infection, there's no precancer, and there's no cancer, and to know whether or not there's something else that we need to treat based on those results. So I look forward to seeing you guys, seeing you for your procedure. And like I said, have a great couple of days until that happens, and we will go from there. I look forward to seeing you for your procedure. And if you have any questions ahead of time, like I said, please reach out. Otherwise, I will see you soon.